Now recognizes Representative Van Orden for 5 minutes for any questions he may have.
Thank you, Madam Chair. Thanks for having us here today. I'm the longest-serving enlisted member of the United States military to ever get elected to Congress in the history of the nation. I get all my health care through the VA, and I love the VA. I want everybody to go to the VA who served our country. I get these rocking glasses in lacrosse. I also get seen in Toma. But when I say I get all of my health care at the VA, I mean also at Crossing Rivers Hospital in Prairie du Chien, Wisconsin, when I can't get an appointment. So again, I can't stress enough that community care is Veterans Administration care because the check is coming from there. So I just want to, because I was an enlisted guy, this is why I wanted to show you something here. These are the recommendations that were made by Ms. Silas's office, and your reports are fantastic. 50 reports is a lot. Okay, so, and these are the things that the VA hasn't done. So if you look at them sideways, they look like they're just about exactly the same thickness, don't they? So if we have the GAO working hard, sorry, I was an enlisted guy, that almost came out, and Dr. Kroviak working hard, and over years and years, since 2018, they gave you this stuff. You have 18 out of the 21 haven't been done. So it is endemic. And I've learned this as a chair of the Subcommittee for Economic Opportunity, that we seem to keep going in these circles. You know what I mean? We got the Government Accountability Office, we got the IG doing stuff, and then it goes to the VA and it just falls into a hole. We forget about it for a while, and then another report comes. You said you did 50 reports, ma'am? 50 reports. If you're by volume to take the amount of recommendations in those 50 reports and showed us what was not acted on in any of those reports, what do you think that ratio would be? There's got to be, how many recommendations are in 50 reports? A lot.
There's hundreds of recommendations.
And so to scale, like how many do you think the Veterans Affairs Administration has not acted on?
I would be much more comfortable getting that number back to you formally.
You can do
but
enlisted
yes.
math. I'm okay with that. The point being this. There is zero accountability at the Veterans Affairs Administration, Doctor, and I'm glad you're coming in, and I'm glad Secretary Collins is here, but there's zero accountability at the Veterans Affairs Administration. And I don't have, hopefully this will change, I don't have any confidence, I mean zero confidence in the Veterans Affairs Administration to be able to plan itself even out of a wet paper sack. Because I've seen it to the tune of billions and billions and billions of dollars of waste. One example is the electronic GI Bill. The estimate from the guys at the VA that it was going to cost $25 million. You know what they're up to now? $960 million from a $25 million estimate. And Ms. Shriftlis McCormick, we had this hearing the other day about the electronic service record. Wow. I mean, it's shocking. I mean, they're up to like $50 billion they think it's going to take to implement from a $16 billion initial estimate. Okay, that's unacceptable. So, I mean, it begs the question, Ms. Silas and Ms. Kroviak, you know, why do you guys even exist if you're doing this, and I mean high quality work, if it's not going to be acted on? So this is more of an encouragement, you know, senior enlisted to, you're probably a colonel or something when you got out?
Yes, I was.
Okay, there you go. So this is your senior enlisted advisor to the incoming colonel. Oh, your command is broken, and it needs to be fixed. And it won't be fixed until you hold people accountable like you would in the military. The Veterans Affairs Administration has to stop acting on a long series of suggestions. And those shouldn't be suggestions. We got to figure out a way to empower you to hold people accountable that don't follow the findings in your reports. And nothing's going to change until that happens. So I don't really have a question. I'm offering you encouragement. I want to thank you ladies for your exceptional work. And if you ever need anything, I'm really good at yelling at people. I can do that all day long. Just reach out to my office and I'll scream at them on the phone for you. Is that good?
Yes, thank you.
All right, thanks, Colonel. I yield back.